I need pain relief. What do you got, Doc?
Vicodin is the most commonly used narcotic analgesic drug that is consumed to relieve any moderate to severe pain in the body. Vicodin can also be found in having the brand names of Annexia, Lorcet, Norco, and Zodol. Vicodin is produced in the Knoll laboratories. The half-life of Vicodin was found to be 1.5 hours to 3 hours because of the rapid metabolism in the liver. Vicodin is a combination of acetaminophen and hydrocodone. When it is first formed, Vicodin is a fine white crystal or crystalline powder, which is then made into a tablet, capsule, or syrup. A normal tablet, capsule, or syrup dosage of Vicodin contains 5 milligrams of hydrocodone and 500 milligrams of acetaminophen. Vicodin also contains 2 naturally occurring opiates, codeine and thebaine. Opiates are derived from opium, dried sap of the Papaver somniferum poppy plant. Narcotic analgesics give the sensation of a euphoria and psychological stimulation, characteristics that make the drug highly addictive. The highly addictive characteristic is the reasoning for the short prescriptions of the drug and is known to be addictive for patients with chronic pain. Other active ingredients include colloidal silicone dioxide, starch, sodium, providone, stearic acid, and many others. All of these chemicals are absorbed by the gastrointestinal tract and distributed throughout the body in body tissues. 85% of an oral dose is found in urine within 24 hours of taking. This drug is most commonly taken after surgery, during cancer treatments, and after heart attacks. Vicodin relieves the pain by binding to opioid receptors in the brain and spinal cord. It binds to the same receptors in the brain as endorphins, which stops the transmission of pain signals from cell to cell. Vicodin is taken during a few days of acute pain, and if accompanied by vomiting, the drug dosage will be injected into the body. Tablets are to be taken 1 or 2 tablets every 4 to 6 hours, and exceeding 8 tablets a day is highly dangerous. Vicodin is to be stored in temperatures of 25 degrees Celsius and can be at excursions of 15 to 30 degrees Celsius. Vicodin dispensers should be sealed in a tight, light-resistant container.
Vicodin can impair mental and physical abilities like driving a car and operating machinery. Vicodin is not to be consumed if 3 or more alcoholic drinks have also been consumed that day. Also, if the patient has an allergy to Tylenol, Vicodin is not to be taken. A doctor is to be consulted upon consumption of Vicodin if the patient has 1 or more of the following conditions: asthma, a liver or kidney disease, a head injury or brain tumor, mental illnesses, an underactive thyroid, curvature of the spine or a drug or alcohol addiction. The most common side effects of Vicodin include blurred vision, constipation, difference of breathing, dizziness, drowsiness, mental mood changes, nausea, and vomiting. The most common allergic reactions that Vicodin causes are rashes, hives, itching, difference in breathing, and swelling of the mouth, face, lips, and tongue. Urethral spasms are very common bodily reactions to Vicodin. Over 4,000 milligrams of Vicodin is fatal and causes liver damage. Chronic overdose increases the user's risk for hearing impairment or loss. In the time of illicit drug use, help should be sought. In this event, withdrawal reactions will include agitation, anxiety, insomnia, tremors, abdominal cramps, blurred vision, vomiting, and sweating. Precautions with the distribution of Vicodin should be especially high with elderly and debilitated patients. Also, any patient that has hepatic or renal function, hypothyroidism, Addison's disease, prostatic hypertrophy, or urethral stricture should not be considered for consumption of this drug. Studies have not been done to find if Vicodin has the potential to be carcinogenous, mutagenous, or a factor in the impairment of fertility. If a mother consumes Vicodin while pregnant, the baby born to the mother will become physically dependent upon the effects of the Vicodin has. Due to the fact that the baby cannot physically consume the drug to occupy the need, the baby will show withdrawal symptoms such as crying, tremors, hyperactivity, reflexives, increased respiratory rates, increased stool, sneezing, yawning, vomiting, and a fever.
Vicodin can relieve my pain. What can it do for you?